Here are 3 tips for helping you find the vein. Tip number 1 is know your veins. When palpating, you will use your index finger, not your thumb. Your thumb actually has a pulse that can mislead you. You shouldn't be palpating completely blind. You need a general anatomical understanding of where veins are typically located. Basically, you need to know your veins. Let's take the antecubital area or the inner elbow as an example. Common veins in the antecubital are the medial cubital vein. This crosses the center and is often the most prominent. We have the cephalic vein, which runs along the thumb or the lateral side. And we also have the basilic vein, which runs along the pinky or the medial side. So when you're palpating, you're not guessing. You're using both your knowledge of anatomy and your fingertips to feel the right vein. All right, tip number 2 is feeling is more important than seeing. You want to make sure you put the tourniquet on before you start palpating for the vein. You want it tight enough so the blood starts to pool in the veins. Feeling the vein is more important than seeing the vein. Sometimes there will be a great vein you can feel and not necessarily see. We are feeling for a vein that is palpable or bouncing, which indicates it's full of blood. Next, you want to make sure when you're feeling, you feel a vein that is straight. You have to insert the whole catheter into the vein. You don't want to insert it at the site of a vein bifurcation. What is a bifurcation? Bifurcation is when the vein divides into 2 branches. There is often a valve here, and we know that won't work for insertion. You can say here that you wouldn't be able to put a catheter in the site of a bifurcation. Tip number 3 is if you're really having trouble finding the vein, think of the mnemonic TAP. T is for temperature, A is for arm position, and P is for pump or pat. Let's walk through them. First up is temperature. Applying warmth is one of the most effective ways to help bring a vein to the surface. A warm compression or warm towel works by increasing the temperature of the area. This leads to vasodilation or the widening of blood vessels. This allows more blood to flow into the vein, making it larger, softer, and easier to see or palpate. A is for arm position. The position of the extremity is key to vein visibility. By placing the patient's arm lower than the level of the heart allows gravity to do some of the work for you. This encourages venous pooling, which means blood is pooling or accumulating in the lower limb, causing the veins to enlarge, rise closer to the surface, and become more palpable. Perfect for starting an IV. P is for pump or pat. If the vein is just not visible or palpable, you can do 2 things. First is pump the fist. You can have your patient open and close their fists slowly a few times. This helps pump blood through the veins, making them bigger temporarily. This is especially useful in the hands, wrist, and antecubital areas. Then we have pat or tap the vein. You can gently pat or tap the vein. Use a soft, consistent tap or light finger stroke. This encourages vasodilation by stimulating local blood flow. But it's important that you don't flick the vein because this can cause spasms or bruising. Just a light tap or pat will do the trick. Let me know in the comments what's your go-to tip for starting an IV.